mean, it's just not good enough. After having been told that it would take 15 minutes, I have now spent over half an hour having my bridge fitted. And shall I tell you why? Because it needed grinding to make it fit, that is why. It still doesn't fit and it's uncomfortable.
I'm sure Mr. Singh...
My jaw aches from having to keep my mouth open for so long. Not to mention I'm late for the hairdresser.
Mrs. Forrester, I'm sure Mr. Singh has done everything he can for you without you having to spend even more time this visit. And he has asked me to make you another appointment as soon as possible for any further adjustments.
Well, I suppose that's better than nothing, but I will tell you this now. If I have to spend another half hour, I'm going to find a dentist that can get it right first time.
Mrs. Forrester, what about your appointment?
Yeah, Mr. Adams' records handy, Liz. What's the matter?
I'm afraid Mrs. Forrester's bridge problems are now public knowledge.
Oh, great. Bad PR on top of a loss of time and money. I think it's time we knock this one on the head.
Hello, Martinetta.
Hello, Martin. Roger. Listen, we're in a bit of a mess here over a posterior bridge you did for one of our patients. We had to spend an extra half hour adjusting the occlusion, and the patient decided to broadcast the fact to everybody in the waiting room.
I'm sorry to hear about that, Roger. Any idea what caused it?
Well, not exactly. Well, the net result was our old friend open bite.
How open?
Relatively speaking, about half a mile. A millimetre to be more precise, but enough to waste a lot of practice time and send the patient into a rage.
Sorry about that.
But the point is, Martin, that these things are happening far too often. I mean, sometimes at our end, sometimes yours, or both. And it's costing us all too much money. Now, how about we get together and work something out?
That's a good idea. Let's fix a time now.
Yeah? Okay.
So, please you invited me down, but I hope you're not just going to point fingers at each other.
Of course not, Martin. The idea isn't to apportion blame, it's to head off more of the same happening. I mean, I don't know about you, but frankly, I can't afford many more disasters.
Well, nor can we. So why don't we get the ball rolling by trying to sort out what happened to Mrs. Forrester's bridge?
Okay.
Thanks. Right. Can you remember what impressions you sent?
Ravi?
Well, can't remember exactly. Sometimes I take a quadrant, sometimes a full arch. But I'm fairly sure Mrs. Forrester was a full arch.
I don't mean to preach, Ravi, but I take it you know the possible consequences of cutting corners.
What do you mean by cutting corners?
I think he's referring to quadrant impressions.
Exactly. Simple fact is that although you might save on materials and time, quadrant impressions tend to give a wrong occlusion.
Well, surely it's up to your technicians to sort that out.
They're technicians, they're not magicians. Without the whole picture, they're just guessing. And the same goes with a putty and wash impression, where you've relined only part of the impression. Now, you might get a perfectly accurate impression of the prepared teeth, but you can also get a step. Plus, you just don't give the whole picture.
Which means a problem bite. Well, how about it, Ravi? Think it could have been the impression?
I suppose it's possible, but without checking. Jenny, do you remember
We'll come
when
to
you
that
said...
in a minute. I'm sorry, Jenny. Something else just occurred to me. Since we were talking about articulation, Martin...
Ah, you mean the occlusal record? Oh, sure, now that could have been one of the problems. You'd be surprised how many records we get that are too thick.
A minute ago, you were saying that we skimped on materials. Anyway, I seem to remember taking an accurate record for Mrs. Forrester. Well, at least I think it was for Mrs. Forrester. Well.
Okay, we'll leave the records for a moment. Let's go back to the impressions. Let's assume, Ravi, that you did full arch impressions that day, and they were definitely for Mrs. Forrester. You were obviously under pressure. Could something have gone wrong with the impressions?
It's possible. I mean, like you said, I was pressed for time. Jenny, could you label those up for the lab, please? Thanks.
You were pressed. I had about a dozen things to send off that day. I wouldn't be at all surprised if something went wrong or missing. I seem to remember there are even 2 similar names.
Ravi, don't you remember anything special that you might have put or forgotten to put on the lab ticket?
Well, not without looking it up, but I'm certain I completed one.
How are you doing?
Oh, don't ask. I've done loads of these things today. I don't think I've ever known it quite so busy. Still, I've only got another 4 more to do. Can you hang on? It was just totally chaotic that day. Right.
Which means there was plenty of opportunity for mistakes.
At our end, too. Apart from everything else, we've got 2 student technicians on board at the moment. One of them's in our model room.
Now, the fact is that Mrs. Forrester's problem could have been due to any number of things. Well, who's to blame isn't important. We're losing time and money due to a lack of care, attention to detail, and communication.
I agree, and I suggest 2 simple things. 1, that we have more meetings like this. 2, that we all keep in closer contact. And that's the message I'll be taking back to the lab.
And let's also agree that we'll all use full arch impressions from now on. And if I may say so, Martin, I don't think you should accept anything else.
Okay.
But I still can't figure it out.
Any sign of Mr. Dudding's cast from the lab yet, Liz?
A couple of things arrived this morning. How about these?
Oh, they're the ones. Thanks. Well, I'm very happy to see that our first meeting wasn't just a one-off. And I think Martin will agree that communication between his lab and us is steadily improving.
Absolutely.
In fact, between us, we managed to get to the bottom of the Forrester puzzle. Bubble in the impression, smudged instructions, and an inexperienced lab technician. Well, apart from 1 or 2 minor hiccups, I think the only current bone of contention is the Dudding dentures. One of mine, I'm afraid.
What was the problem?
A dropping upper and a loose lower. Oh, lovely setup, Martin. They'll do nicely. Ah, can you get Liz to pack these? We'll soon have Mr. Dudding gnashing with the best of them.
So, what kind of trays are you using for your working impressions these days, Roger?
A nice try, Martin. But Ravi got there well before you, by several months, in fact.
When I joined and saw they were still using cheap plastic stock trays, I started a one-man campaign for special trays, and won.
Couldn't have been over-polishing by any chance.
No, your people have been very good about that lately, and I'm always explicit in my instructions not to touch the periphery.
Well, I think it points to one thing.
If not several. So while you did indicate that we should put the lower posteriors over the ridge,
I forgot to mark the position of the post stam on the upper. Anyway, we've rectified Mr. Dudding's problem and learned yet another expensive lesson.
so what's on the agenda this time?
The poor colour matching of Mrs. Atwood's 3-unit bonded bridge. In fact, the whole area of shade matching.
Well, it can be a nightmare.
An expensive nightmare. Talk us through it, Ravi.
No problems really. The prep went well. Managed to get a good shoulder width and a good impression.
Are you sure it was enough?
Absolutely. And this was confirmed when the working model came back. Now have a look at what ultimately came back from the lab.
Sometimes the message just doesn't seem to get through to our technicians. Have a look at these. I use these to demonstrate what can go wrong. For instance, where we've accepted impressions which have either inadequate shoulders or no shoulders at all. No prizes for guessing the net result of that. Or where the clinical preparation was fine, but the technician was overgenerous with the opaque layer. Or where the technician waxed up the pattern incorrectly, which causes the metal coping to be too thick. Now, I think the answer to the Atwood problem lies here, or at least part of it. But Ravi, can I ask, how did you match up Mrs. Atwood's shades?
The usual way.
Which is?
It was quite late in the day, so instead of daylight, I had to use the operating light.
Ah.
Can you translate? Ah.
It means that artificial light isn't always the best way to get a good match, apart from the fact that our lights just won't match yours.
Okay, but I do indicate the shade to your people by standard shade guide.
Well, I assume there was no characterization involved.
Not necessary in this case.
Right. Well, I'd say that we've probably got enough evidence to clear this one up and prevent it in future. So I came back from a fabulous holiday.
Oh, yes, how was France?
Extremely French. To find that my locum had, along with your lab people, contrived to provide Mrs. Goslin with partials that looked like they came from a joke shop.
And specifically?
Well, let's start with gaps through which you could drive a bus. Then there's the fact that Mrs. Goslin was terrified to smile in case her upper obeyed the immutable laws of gravity. And just for good measure, let's talk about the fact that the shade variations wouldn't have been out of place on a decorator's colour chart.
So apart from that, Mrs. Goslin's dentures were...
Perfect.
Didn't Mrs. Goslin have some abutment crowns made prior to the dentures?
Yes, I did a treatment plan for the partials. We had models surveyed, and the abutment crowns were going to have guide planes and rest seats. Unfortunately, according to Jenny, the locum apparently decided to ignore the plan.
And neglected to communicate with your technicians, Martin.
Anyway, enough said about that particular debacle. Except that I think we'll all agree that particularly in complex cases, treatment planning is crucial and must be followed, whoever does the work.
And that it's wise to involve the lab.
Well, while we're all here, how about putting all those wonderful ideas on treatment planning into action? It just so happens that I have a case that would benefit. Mr. Maynard's a new patient, 40. Obviously cares about his appearance, which is why he wants to do something about his upper front teeth.
Is it bad?
There's a lot of work to be done.
There's a hell of a lot of wear.
Quite a bit. He had an operation for a duodenal ulcer. Before that, he was vomiting, but I think the erosion stopped now.
So is he already wearing dentures?
No. When you look at him, he has lots of back teeth missing, and the rest are heavily filled. He has some gingival inflammation, but there's no bone loss.
What about the occlusion?
Well, as you might expect, with the loss of so many posterior teeth, there is overclosure. On top of this, he's come forward into an edge to edge. And the upper right 4, upper right 3, upper left 3, and the lower left 3 are over-erupted. That means the only posterior occlusion is between the upper right 7 and the lower right 8. When you put him into retruded and put the pin at the correct face height, this is what he looks like.
How much contact did you have with Martin's people during all this?
Plenty. Apart from the toing and the throwing of the actual impressions, lab tickets and casts, I must have been on the phone 3 or 4 times about the plan.
And now you're ready to get on with the treatment plan, and you'd like a little help from your friends.
Couldn't have put it better myself.
Well, I've got a better idea. Instead of us doing the work, let's see what they would do.
Who?
Them. You'll find all the detail you need in your case books, and there's plenty of room to scribble down a plan. You'll also find the treatment plan that we eventually decided on. Is it successful?